Hi everyone, it's Dr. Amy, and in this short video we're going to go over the functions of a tongue and when a tongue is restricted or tongue-tied, how that can impact normal function of a tongue and how it can impact a person's life. So I'm going to zoom in here to a little drawing that I've made. Okay, so what you can see here is a diagram of sort of the tongue if you were to open a person's face like a door. I know that's kind of strange, but this represents the tongue right before it's about to push up against the roof of the mouth and swallow. So when a tongue swallows, it exerts 500 grams of force on swallow, and that's about 1,500 to 2,500 times a day. For reference, it takes 1.7 grams of force to actually move a tooth orthodontically. So 500 grams of force, 1,500 to 2,500 times a day is very powerful forces we're talking about biologically speaking. So when the tongue exerts 500 grams of force on the roof of the mouth or the palate, it does several things. One of the first things it does is it shapes the palate. So the roof of a person's mouth should look pretty much like this nice broad arch of the tongue, and the tongue, when it's not swallowing, should rest up in the top of the mouth. This orange line represents an altered palate shape. You'll see this in babies, and because swallowing starts at 16 to 20 weeks in utero, having a high palate or an altered shape is almost a pathognomonic sign or something that's very, very indicative of the tongue not functioning properly and most likely being actually restricted, whereas an older patient could have sucked their thumb or done lots of other things to create a poor palate shape. So you have the tongue pushing against the roof of the mouth. It's not only shaping the roof of the mouth, which is the upper jaw, but the tongue is also driving the growth and development of the face, jaws, and airways. So to get these nice, beautiful cheekbones, a nice long jawline, and really good airway development behind all this facial growth this way, the tongue has to do its job. So it's driving the growth and development of face, jaws, and airways with that swallow. The other thing it's doing right from the very beginning is these are your maxillary and nasal sinuses, your ocular sinuses, and then these ear represent, there's a little sling muscle that basically when the tongue is in full action and swallows the way it's supposed to, it releases your ear, your eustachian tubes, which what we see in people with a tongue tie, and particularly children, is that these things aren't happening as well as they should. So we might have more fluid in the ears, we might have more congestion or junky breathing, goopy eyes, of course the funny shaped palate, but we have all these kind of things going on in a baby and toddler, and even sometimes, you know, as we get older, it's chronic sinus infections and so forth, but I'm mainly focusing on babies and children. So this is part of the tongue function. Moving down here, I just have listed some things that are also tongue function. And this is not a comprehensive list, but it's just to give you an idea. What I find is when I go over this with parents that generally there's a lot of ahas taking place. So tongue functions, growth and development of the face, jaws, and airway, really important. Swallowing. So the tongue is very important in moving the food from side to side, lateralization, and creating this small ball called a bolus and shooting it down the hatch. When the tongue is impaired, the person will find a way, obviously, to eat, but they may have what we call scatter on their tongue. So right before they swallow, if you looked inside, you would see a bunch of food scattered rather than a little small bowl that they can easily turn down the hatch. So when that happens, basically, when I meet parents and their kids are 6 months or a year or a couple years old, they'll tell me that their child is a picky eater. And when I ask more about that, they usually eat softer processed foods because they're having a hard time with meats or vegetables or certain textures that would make them choke or gag more because it's harder to get those fibrous foods down the hatch, so to speak. So picky eaters, soft processed foods. I won't go into it in great detail here, but you can look on the blog about how soft processed foods are a double whammy for the dentition and cavities, also for the overall health and so forth, and for the growth and development. The next thing we have is speaking. So whenever there is a tongue restriction, articulation can often be a challenge. So you'll see delayed speech. So I see anywhere from 1.5 years to 2.5 really frustrated toddlers who either are delayed altogether, or their speech, you can understand them but no one else can, so they're throwing lots of fits because they're trying to communicate but they can't. Anterior airway patency. So what this is important is for sleep. In 2016, research came out to show that a tongue tie is a marker for sleep apnea. So if you think about it, if you look at a diagram of the face and the jaws and the airway, the tongue is a part of the front of the airway. And so when you're at rest, it should look like this. My tongue is in the top of my mouth and I breathe through my nose. If you're tongue-tied, often you'll see just the lips parted, and that's a little bit of mouth breathing, which is a big deal for kids. And the tongue is in the middle or bottom of the mouth, which makes this big, huge 8-paired muscles down and back into the airway space. So at first it might not be a problem. It can be. It depends on how the child's grown. If a baby's born really retrognathic, where their lower jaw is set back, that tongue down and back in the airway from early on can create huge problems and sleep apnea even in a young child and obstructing the airway in sleep. So, but the reason we have this listed here is 2016, we found out a tongue tie is a marker for sleep apnea. Again, I don't want to go into it in great detail here, but I do want to let you know that you can look at the blog. We have some other lengthier videos. Just know that when the tongue is down and back in the airway, and then you throw on top of that mouth breathing, which usually happens, you're really crowding up the airway with enlarged tonsils and adenoids as a result of the mouth breathing. Sleep problems, it's illegal to give ADD and ADHD medicine in Australia because sleep apnea or sleep deprivation or lack of oxygen to the brain in children look just like ADD and ADHD. So if you're having a child that's got a lot of challenges with focus and behavior, you may have a child that's having a problem with his airway at nighttime. So again, I've already kind of mentioned this a little bit, but clearing all these sinuses is really important. And so tongue tie or restrictions, basically what we find, what we find is that when a tongue is tied, sometimes people will ask, is this a severe tie or a mild tie or a moderate tie? There is no such thing. That's like saying you're mildly pregnant because you're in the first trimester. You're either pregnant or you're not pregnant. A tongue tie is now an objective measurement. And so if you go to a provider and they say, oh, you're kind of slightly tied, or it's a little tie, but we don't need to do much about it, or I'm not sure if we should do something about it, they are probably not using a validated protocol. If you're using a validated protocol, you can assess whether a person is tongue-tied or not tongue-tied. If you are tongue-tied, what is mild, moderate, or severe is how much that tongue tie is impacting your quality of life at that moment in time. So lots of things can help babies, children to what we call compensate. So the tongue tie may not really be affecting the baby's feeding because they're on a bottle, or because mom has really great anatomy and milk supply and she's compensating, the baby's just drinking, not really nursing. So really you need that structural assessment to say, is this a tongue tie or isn't it? And if it is, in my opinion, because all of these things can and do happen, I see them every day in my practice, if you know your child is tongue-tied, the best standard of care and the highest quality of care that we can provide is to actually fix the tongue tie when we see it, not wait until these problems develop. So there you go. Thank you so much, and please check out any other videos that have topics you think would be helpful in your journey.